Okay, there you go.
Good morning. My name is Harrison Pierce. I'm the chairman of the Health and Human Services Commission. This is just a reminder to please state your name and title if there is one. And this is for the public record, and this is at a request of the governor's office. Thank you for zooming in this morning. I was hoping that we'd be meeting in person in September. It has been a long time, but the way the numbers have been going, et cetera, even though there was a little positivity last night because the testing in Connecticut had dropped below 3% for the first time in a while. But I think for the foreseeable future, we will continue to be meeting via Zoom. Hope you all had a great summer with its limitations, and let's get on with the agenda. The first item is the approval of the July 1st minutes. Any questions or corrections? All those in favor of the minutes as they are written?
Aye.
Aye.
Aye. All opposed? Okay, approved. Thank you, Alyssa, for another great job.
Thank you.
Okay, so reports, Health Department. So Jen Eielson, our Director of Health, is on a vacation, much needed, much deserved. After 2 years, it's been a very busy year with many hours per day. She did give me her report, which I will go through with you. First thing, just the vaccination update in terms of numbers. The ages 12 to 17, it's 92% have been vaccinated fully. Ages 18 to 24, 100%, 25 to 44, 100%, 45 to 64, 87%, and ages 65 plus 100%. They're all great numbers. The town itself is in the 70 percentile, but that includes the less than 12 who are not eligible for the vaccines yet. Boosters. You've seen lots of this in the news, and presently doing it only for immune compromised individuals. And it's 8 months after your second dose. And the plan is for the new Canaan Health Department to again vaccinate. The first selectman is very happy to do this and support it just because it provides easy, accessible access to our residents. The site is to be determined. It will not supposedly be at Lapham because of pre-scheduling items, but we will keep you updated. Rapid testing update. Health Department has been testing at the Vine Cottage. They're doing the rapid testing, which is usually Abbott, Binax Now, or the BD Veritor. There are two, aside from Amy, who is the public health nurse, there are two substitute school nurses, Maria and Renee, who've been a big help, both giving the vaccines previously at Lapham, as well as doing it at Vine Cottage. And they're also doing the rapid testing too. So we are thankful to them.
Where is the rapid testing being conducted, Harrison?
Right now at Vine Cottage.
Okay, thank you.
You just call, make reservation, and that's out there.
Great.
Community testing update. The town partnered with Waveney, and so they are doing PCR testing twice a week. And thank you, Waveney and Russ. Let's see, we mentioned last time there was a concern on Jen's part and all of ours about the public health nurse. Well, apparently the grant has been continued through November of 2022. So she will be there on her usual schedule basis. And Jen reports the regular department updates. The septic permits, plan review, soil testing, inspections continue to increase. And that's all because of the exodus out of New York still, and to New Canaan, and construction, et cetera. So that is the report from the Jen and the health department. I'll just add that the hospitals locally, mostly New Vance, which is my source, and Norwalk Hospital, over the past month, they've seen about a 10% increase in COVID cases. 10 days ago, Norwalk had 8 COVID cases. There was, the system had 50 in-house with COVID, with about 30 patients under investigation. These are mostly unvaccinated individuals, but not all. The recent numbers on those who are vaccinated and less than 75, their hospital prevention's in the realm of about 95%. But once you get to be beyond 75 and 80s, 90s, then it drops to about 80%. So even though the vaccines are great, they're not 100%. You've read and heard about the children's hospitals being overwhelmed these days, and that's because that 0 to 12 is not immunized, and the Delta is very contagious, more contagious than the Alpha, which was our first. And but there are other things contributing to this too, and all these respiratory viruses that we really didn't see because of the masking and the distancing, et cetera. And when those things were relaxed, they, even off season though, with the respiratory viruses are usually autumn, winter, but they had seen increasing numbers of these things during the summer, and that's contributing to the hospital census being as high as it is in children's hospitals. Concern about cardiac complications.
Hey, Harrison,
Yes.
it's Jim.
Yeah.
You may have covered this before I connected by phone, but is there any kind of a plan so far from the Connecticut Health Department about the third shots?
Yes, New Canaan will be giving the boosters. The site is to be determined. It's only for immunocompromised individuals, certain health conditions. And there is some discrepancy out there. The FDA, Food and Drug Administration, has to okay it. The ACIP, which is the American Council for Immunization Practices, has to do this also. So we're away from everyone being boosted, but for the immunocompromised, yes, it is there and available, and New Canaan will be doing
And
something.
that's available now?
That will be available. The site is to be determined.
Gotcha. Okay, thank you.
Okay.
Yep.
I just briefly on the cardiac complications from the vaccine. It does occur more commonly in male teens in this first, but when you look at the numbers, it's significantly less than having the disease itself. To the point with if 1 million vaccines, 9 people are going to have some cardiac, by the inflammation of the cardiac muscle or the inflammation of the pericardium, which is the covering of the heart. And they're considered to be mild, transient, and without longstanding complications for the most part. So that would be 9 per million. And from the disease itself, it's 67 per million. So there's quite a difference in terms of numbers. So that's pretty much the update on the vaccines and COVID questions. Okay, let's move on to human services. Bethany?
Yeah, hi, everybody. All right, I'm going to go through some of the programs we're doing. Food pantry, we've seen an increase in households coming in. There was a lull. SNAP, food stamps, has been paying additional monies to the people that qualify, and as a result, it did lessen our number of shoppers coming, but now that's revving up again now that summer's over. We have continued blood pressure clinics at Lapham and Schoolhouse, and those are well received. We'll continue those. We do the Schoolhouse once a month, and we do Lapham every other week. The back to school program, I'm going to let Jackie go into that, but I just wanted to acknowledge Staying Put, NCL, New Canaan Moms, and Salvation Army really made a great program for us, and Jackie will go into that, but those were the contributors. Let me see, Medicare Part D enrollment begins October 15th. And so Marcy will go into it more if she wants to, but we're dusting off our Medicare Part D enrollment hats, and we're going to put those on for a couple of months. So we're doing the training and the updates to what's going on for this year and the changes and problem solving for those people that wish to contact Human Services, but it's also at Lapham Community Center too. Marcy and I tend to do the problem solving aspects where the counselors at Lapham, you go in and you find your program, your what you want for the year, but if there's any issues, they usually come to us. The EOC was activated on Sunday for Hurricane Henri. Enz and I were there from 8 to 2, very uneventful, thank goodness. And so that just plateaued, ebbed, and then closed up. All of us, the staff, has noticed that there's definitely is an increase in community awareness for Human Services. We're receiving calls not only from individuals, but from agencies and such as, the police, Adult Protective Services, Meals on Wheels, the walk-ins are coming. And it's just, the staff is just amazing with their resources and their knowledge, and people are leaving. I feel, with resources as well as an avenue for resolution for whatever their situation is. So I do feel as if our kind, non-judgmental approach, and knowledgeable on resources is definitely helping the community, and we're seeing an increase. Let me see, seniors. We do have a lot of seniors calling about boosters for COVID. And what we do is we're taking their name and contact info and sending it over to the health department. That was the instructions that were given, and Shannon is keeping a list, and should things change, go beyond the immunocompromised, and we can start doing those in an specific age range, we'll start doing that as well. That's about it. I'm just really proud of the staff and working together, and just really, I think we are definitely a service to the community. And so that feels good, selfishly. Okay.
I'll second that. It's a great staff. New Canaan is fortunate to have you all.
Thanks.
Yeah.
Okay, Marcy, you're one of them.
Okay, I am Marcy Rand, the Adult and Senior Services Coordinator. I am finishing up Renters Rebate Program right now. In August, I completed 17 applications. The total amount of rebate was $9,200, but that is not including Schoolhouse, which I am anticipating on getting in the next week or so. So that will be another additional, I think it's 13 more applications that I'm going to get from Schoolhouse. As Bethany mentioned, we have been receiving more concern calls from organizations as well as referrals from the police department, which is fantastic. We're thrilled about the community awareness, and that, we are a department that is known to be of some help. So that's fantastic. There has been an uptick in adult protective service cases. I've done about 7 home visits in August, and the primary concern is really regarding the safety of the seniors, and they're making sure that they're receiving the appropriate care. Neighbors and other organizations have called about them. So they are now on our radar, and it's been great working with Adult Protective Services. My visits to Lapham begin next week. I'll be going in twice a week for about an hour and a half at a time. One visit will just be a conversation group, sort of very casual conversations. And once a month, I'll be having the police department come, and we're going to be having coffee with a cop once a month. And then another visit will be sort of a peer support group. It's a little bit organic. We haven't quite figured out a tempo yet, but we will be working with one of the senior residence is also a social worker and very active at Lapham, and she would like to co-host this group with me. So we are going to be doing that together. I'm going to meet with her tomorrow, and it should be a really needed and fantastic group. And as Bethany said, open enrollment starts in October. So we are going to start our training on that, as well as energy assistance begins September 14th. So I'll be getting another training on that and starting that up as well. And I think that's about it.
Thank you, Marcy. Jackie?
Hello, everyone. This is Jacqueline DeLuey. I'm the Youth and Family Services Coordinator for the town. I hope everyone can hear me. We think we fixed my Zoom, but I'm not quite sure. So I've actually gotten 4 new families in the month of August. And actually, we were able to offer them backpacks or like at least offer. A lot of them were already taken care of because they connected with us later in the month. But it was nice to know that we did have a couple of overflow backpacks and stuff. So they were really happy about that. I had mentioned in the past some families that were moving, or I had one call me that they moved to Trumbull. And then I had one that we kind of deemed doesn't qualify right now. That could change, but the landlord, employer purchased a place for them. So right now they're not paying the rent. So we just deem that they have, a little extra income, but that could change at any point. So, and I definitely think we'll see some more families come our way when Canaan Parish is up and running, because that was adding to family households. So that's great. Bethany had mentioned back to school. I was worried because, we're allowing people to come into the building. Some brought their kids. I just asked everyone to mask up, and they didn't spend a lot of time inside the building. So that was great. Hang on. I have someone that's going to be coming to pick up some backpacks. And of course it's this, the morning I'm on the call, but that's not them. So it was about, I think, 65 kids that benefited. We were able to hang on to some, but, we purchased them, and they're great backpacks. If anyone remembers, Jansport is still around. That's a great brand. So we're able to hang on to them, and we could see new families that come in and maybe they need that resource, or we can give them out next fall because they're great. A lot of them have USB cords in them. This is a new thing, which is very cool. Families were excited to see that. Also, DD, domestic violence planning is underway. We are able, to do a proclamation in front of the high school with our first selectman and my co-chair, Dee Dee Bartlett, and the principal, Ari Rothman, over at New Canaan High. We're toying with either it's going to be Friday, October 1st or Monday, October 4th. I can let anyone know if they want to pull up and, just stand outside and hear that proclamation. We hope to have students join that. We have filmed it in the past, the school has, so at least if kids for some reason weren't able to attend, they could see it on their school TV. So that would be good. We would be okay with that if that keeps everybody safe. We are in talks with planning a bystander intervention training at the First Presbyterian. That'll be held in October. It's going to be partnered with our partnership, New Canaan Cares, and the Domestic Violence Crisis Center and First Presbyterian Church. So we're excited about that. I'll let you know in more details where that kind of came from. This is going to be for adults. New Canaan Cares was doing a few of these events for kids at the library in the month of October. So we thought, let's do one for adults, and New Canaan Cares jumped right on board to help with that. But the nice thing about that is I approached the library because we used to put purple pinwheels with NCL out on Vine Cottage property, and that's not available at this time. And also we're not housed there, so it doesn't make sense. I've done it in front of the police department. I don't know how much traffic, like how many people see that. So I said, let me ask the library, and they're very happy to accommodate. So we're going to do that with an NCL group. That's either going to be, again, September 30th or October 1st. And that's a 7th grade incoming NCL group. I'm excited about that. You know, some of the awareness at lunch tables in October at Saks and the high school, not sure that's going to be allowed, but I will keep you posted. I'm happy to do it even if it's just me as one extra person they allow in the school, and I don't bring, you know, other people with me, and maybe get a school staff to kind of help partner on that. That would be great. And then we were asked if our podcast talking about it they could use our space again to film. They use like a room in the back here. So we're happy to accommodate them. So they're going to be filming here in October. And I think you'll be happy to see some great people we have on the agenda for that. I know we're kicking off one the middle of September with Emily Torchiana, who we've mentioned. We've had her come to the community. She's got a background, suicide, sexual assault, bullying. So we're really happy to have her come. And then one really cool thing, I met with the library last week, really engaged staff. Like they are feeling good about feeling like they have time to attend things and I guess in the past they've felt like less, you know, understaffed, or maybe they didn't have the right people, but now they are really excited. So we met with them. It was myself, 2 librarians for the kids department, Canaan Cares, talking about how we can help the faith-based community, like the youth groups around mental health. And they've really come to us to say they really want stuff. So we're kind of playing around with what that looks like. We know from the schools that kids learn best from having their actual, like, so if the youth leaders give that sort of education to them, maybe it's mental health first aid training, maybe it's a couple of guest speakers. We'll kind of some smaller groups. I know Canaan Cares is looking, you know, eager to do some peer groups with youth. So maybe it looks like that. So just happy that they're, you know, came to the table and want to know, you know, we certainly all have great resources to share. So that'll be underway and exciting. Trying to think and actually I have a meet and greet. So we were trying to have a meet and greet with people from the community at Canaan Parish was the idea for new families moving there. Of course, construction, I think our clients can move in middle of September. Their community room obviously isn't available. We were going to hold that at Millport one day. It was, and asked both families from each, you know, housing to come to that. It was a day that it was going to be held outside. We didn't have a tent, so it was the school. I've included the library. I think we were going to have the Y. We were going to offer it to kids in crisis, but obviously you'll hear later we don't. That position is available at this point. So we're actually going to be able to hold it at East School because most of the kids that are elementary age go to East School at both those complexes. So we're going to hold it at East School, and it's next Friday morning. So I was happy to be included in that. I had mentioned we hired the Board of Ed hired a community outreach social worker to help kids that struggled with engagement with remote learning. So I will get to meet Jenna. Her and I have already worked on a few cases already. You know, school has just started, but anyway, so that's exciting. I'll keep you posted on that. I think that's it. If anyone has any questions, feel free. And hopefully you heard me. Oh, and I'll be at the vigil tonight. So I'll look for whoever is going to be in attendance on that.
I wanted to definitely reiterate. So the Health and Human Service Commission was very kind in donating, covering like 25% of the cost of the vigil that's happening tonight, coming out of public health services. You had money left over and we needed to use it up. And Paul Reinhardt came to Human Services and asked if we could help sponsor. So we have given $2,500 for the event. And so thank you for passing that and allowing them. It really helped them out. They're very grateful to Human Services. And yeah, Jackie and I will be there tonight. 7 o'clock.
Thank you, Jackie. Okay, old business. First, Kids in Crisis. So just to refresh, Kids in Crisis has been in existence since the 1970s and involved with many schools, mostly at the high school level, but also middle school and becoming more involved with different middle schools. So, and they are, for the most counselors, most of them are clinical social workers. Kids in Crisis also has a 24-hour hotline, and they do have a shelter, and they have psychologic and psychiatric backup. So we discussed with Jackie and Bethany, myself, and we've met and talked to the Kids in Crisis people on a couple of occasions about the need in middle school for a counselor. And we looked at sources of funding, et cetera, which we did get. And from Dr. Lutzy, via the, I think it's the CARE program related somewhat to COVID, at least for the first 2 years, we would have to find funding for the following 3, which was the plan. And last year we did meet with Grace Burke, who was the Kids in Crisis counselor at the high school. And one thing that was good about Grace was that she's a graduate of the high school, knew New Canaan, et cetera. So after going through all this, unfortunately, Grace did leave. And she accepted, she lived in Manhattan, was commuting, and did get a job in Manhattan. So she is no longer here. And with our conversations with Kids in Crisis, it's been a little difficult at this time. They think things will improve after Labor Day, but to get qualified counselors. And so right now, New Canaan High School and Saks do not have anyone from Kids in Crisis. Hopefully that'll change in the near future, but TBD. Wasn't sure what the role of HHS was. So we did, request and did get the funding. We have been involved with Kids in Crisis as one of multi-headed administration. The high school too has been involved. The Dr. Lutzy, who's the superintendent, Susan Bliss, who's the student coordinator for support, has been involved too. In fact, she interviews all the people the Kids in Crisis presented to see if it would be a fit in the New Canaan public school system. So, but that's where we are right now. And we're without a support group from Kids in Crisis counselor at the high school or middle school. We do hope that changes. Susan Bliss, the special support coordinator, did hire a social worker to be of assistance. The Kids in Crisis works, they're not employed by the school system, but they work with the school. This other person would be employed by the school system and will hopefully fill some of the gap left by our council leaving. And so that's where we are. Bethany, why don't you chime in?
Harrison, Bethany's Tom. My recollection from years and years back that this was an expense that was assigned to our budget for outside agencies because the school system did not want to be in the business of offering counseling like this. They wanted to have it handled essentially by a third party. And I don't exactly know the reasoning, but I suspect that they wanted to, it gave an extra layer of confidentiality to the students because the administrators and the principal and the people in the schools were not in the loop as to their personal private issues. Does that rationale still hold? That was a long time ago when we originally put Kids in Crisis person on the human service budget, and it must be 15 years back. Is that rationale still valid now? And if it is, then great. But I just would ask that question before we proceed and hire another person.
Yeah, I mean, that's the idea, and that's the way it has been, to keep them somewhat separate and distinct. But, you know, when we're going and looking for funding for the counselor at Saks, we did go through Dr. Lutzy and some of his available funding to do this, at least for the first 2 years. But, you know, they work in a coordinated or complementary fashion, even though they're not employed per se by the New Canaan Public School System. Bethany?
Yeah, definitely. Harrison and I had a meeting this past week with Susan Bliss and Kids in Crisis director, and another one of the, what was she, Harrison? The counselor, head of the counseling for all the towns that they cover. Anyway, Susan Bliss was very complimentary and supportive of having Kids in Crisis at both schools. It takes any type of confidentiality or anything that's going on, it's not on their records of the student. And that is a huge motivator for them to go and see someone at Kids in Crisis, for the parents and for the children. They also have, the 24/7 hotline, safe, shelter. It's not just the counselor that we're paying for, but listening to Susan Bliss, they are relieved that there's someone there that they can guide towards, but work with. And at the same time, it doesn't go on their, in their files, which is definitely helps the families and the children come forward seeking help.
Great. So basically, the school system would like to keep it the way it is.
Yeah.
And we're happy to be
Yeah,
supportive.
and they're over the counselors too. I mean, once again, there are only so many counselors for all the kids and things like that. So it does take off a lot of the stress and pressure from having them, they're working on other things, classes and career counseling and things like that. This puts a crisis right up front to someone who is solely there for kids in crisis. And definitely the school is relieved to have such a counselor as well.
And
The other benefit. Hello.
Go ahead.
I was going to say the other benefit is the fact that for years, I think it was Ed Milton was there and then was supplanted by this lady who just left. But within the student body, it's well known that the Kids in Crisis person is there and develops a separate set of relations that are outside the academic milieu, as it were, that the school system is responsible for. So the interesting thing is that, and net is that Ed, I know when we looked at this a number of years ago, was keeping track of who the problem children could be and was shooting ahead of the ducks, as it were, in terms of those kinds of problems and dealing with the problem before it became a burning fire. So at the end of the day, it still makes sense. I love the idea, and certainly the organization is a Swiss knife capability in terms of handling issues that have a lot to do with the success of the school system, not academically. Anyway, that's my 2 cents worth.
Yeah, the middle school was very much in favor, right, Jackie? And including the principal, just because, as we've discussed, the increasing need for mental health for children, somewhat COVID related, and where it's become the primary concern in the pediatric arena. So that's where we are, and hopefully we will have someone in the near future at both places.
I wanted to add that they did say, what we're paying for their salary, the fact is that there's no one there now, we're not going to be charged for the salary of someone that's not there. We discussed that. So financially, they're being fair. And they are looking, and they are taking it seriously that we do not have anybody but their services, their 24/7 crisis services are still available to us, but we really don't use them unless there's someone in these schools seeking out, or children seeking out them. But we're going to have to work with what happened, and I really have a lot of confidence that they will get somebody. Harrison and I were very serious about the need, and they agreed. So we'll go from there and keep you updated.
Yeah, one of the issues was that COVID-19, some people are hesitant to go into the school environment,
Yeah,
that being what it is. And also for Grace Burke, who was doing things on Zoom was not ideal for these counselors, and which was another issue. I mean, we did discuss where sometimes freshmen and sophomore in high school do like it because they don't have to deal with all the social issues, et cetera, at school, but the other seniors, juniors and seniors did. But the hybrid scenario was somewhat difficult in terms of establishing relationships, et cetera. And there are different personalities, as we've told, that seem to fit the position better than others in different environments, be it, in person, on Zoom, et cetera. So yeah, hopefully they'll have someone in the near future, but TBD. Next item on the agenda is suicide post-prevention. Bethany, why don't you comment on that, where we are with that?
I'm sorry, I just had someone come in.
Our suicide post-prevention, how we did have a Zoom meeting with multiple people, different arenas.
That
And-
went that went very well. What we did, we connected with outside agencies that were possibly in the event of a suicide or crisis, that could be resources for us. So there were 18 agencies and municipality departments, from the police to Silver Hill to Kids in Crisis, a number of them. And we decided it's not a committee that's going to meet all the time. There's nothing to discuss, but we formalized the group. So in the event of a crisis, the goal is to prevent any, or to help decrease the chance of a contagion, suicide, or other crisis. We would bring the group together. We would discuss the situation to see what agencies, departments need to be involved in this. And then we would go from there. The protocol would be the police department, in the event that there's not a criminal investigation going on, would contact Human Services. At that point, I would bring together the committee. We would discuss the information that we were allowed to be given through the police, and just decide we have to keep the respect of the family intact, and they might not want our help. They might have a networking that's already involved, they're involved with. So we'll see. Sometimes it would be whomever the point person is, contacting them, or maybe the church, to see what would benefit the family the most. And that could be anything from no intervention at all, or helping them find resources. Then there's the community aspect. And we as a community, the group would also decide how the information, well, the police would be the public information officer, and so we wouldn't have any control over that. But what we could do, if there was anything we could do as a community, to provide counseling or something that would help decrease would increase the postvention capacity from a community level, to hopefully not have a contagion response. So
Yeah,
it really is just in time decisions based on what the variables are. But we have formalized the group, and I think it's a good group to have. Everybody's on board. But definitely each situation is going to call for a different set of agencies if children are involved. If not, there was a suicide last week. It worked beautifully in terms of the police were able to contact me. I spoke with the point person at the police, and all family. This was a elderly person in 90-year age span whose spouse had passed away a couple weeks before. All the family was in way out of state, things like that. There was nothing for the group to do for the community. It was just a very isolated event, sad, but not a crisis that we felt that the town needed to pull together with. So just to give you an example.
Yeah, and all the sources are offered for these people. And I think with this individual too, he was said, well, not now, maybe in a couple of weeks or whatever. And when things happen that impact school children, families, et cetera, Dr. Lutzy has had, gets the counseling staff, et cetera, involved, and they do deal with this separately, with always the input from the family, or at least making them aware of what's going on. So it's a good skeleton crew to have, and it's a good service that we will be providing going forward.
Yeah, I will
Great.
stay up to date on the post-vention best practices, evidence-based. There is a township up in Massachusetts who clearly, I mean, they've done a whole toolkit. I am, using that as a base. It works. They continue to upgrade it or make changes. And I've spoken with the department that does this. And so I feel, we do have a grasp and we'll stay current in terms of best practices.
Thank you. New business?
I had a question. There was a news headline that got eclipsed by COVID, but it was quite significant. And it was that in the last year, the number of opioid-related deaths in the country zoomed. It went up by 20–30% to an all-time record. And that has not gotten a great deal of press because of the pandemic. But it's a pretty alarming statistic. It might even be related to the pandemic, but are we seeing signs of that in our local area? And what is there anything that I know we're doing stuff, but is there anything more that people should be doing if that's the case?
I've answered that one. Come tonight, individual, and we all discussed this tonight. You're going to have 3 speakers that are going to talk about that subject. So I encourage, if you want to know about it, abuse and the whole thing, see you tonight at 7 o'clock. Thanks.
Thank you.
Great.
Thank you, Lance. Okay, I think our next meeting will be October 7th, 2021 at same time, and it will be Zoom. Again, thank you for attending. May I have a motion to adjourn?
So moved.
So moved.
All in favor?
Aye.
Okay, thank you. Enjoy.
Thank you.
Have a good week.
Okay, bye.
Good night.
Thank you. Bye.
Thank you, everyone. Bye-bye.
Bye.